Good day, everyone. It's nice having us join us on yet another episode of the Yaba Voice webinar. Today is a special edition of the webinar, and we're looking at commemorating the World Mental Health Day. I don't know if you know that every October 10th of every year, we actually celebrate World Mental Health Day. And this year, the topic of discussion or the theme for the year is something very, very unique. And we thought it fit to share that topic with us, even on Yaba Voice, so that people would understand more on this issue of mental health and how they can actually access help and care and be better informed in areas of functioning that would help them to enjoy the best of mental health. You're welcome once again. I don't know if it's afternoon, evening, or whatever the time of the day is, wherever you are now, but please sit back and just feel relaxed, comfortable, while the medical director, Dr. Olubenga Oye, welcomes us formally even to this webinar. Over to you, the medical director, sir.
Thank you very much, Mrs. Kemi Akintoye. Good afternoon, everyone all over the world and everywhere in Nigeria. I welcome you to this special edition of webinar by Yaba Voice to commemorate this year World Mental Health Day. As you all know, Yaba Voice is a platform for mental health education, advocacy, and community outreach. It is a social media platform of Federal Neuropsychiatric Hospital, Lagos, through which the hospital creates awareness and educate the populace on mental health issues. Today's topic is mental health in an unequal world, the realities and the way forward. October 10 is observed as the World Mental Health Day across the globe every year. And the overall objective of the World Mental Health Day is to raise awareness of mental health issues around the world and to mobilize efforts in support of mental health. The day provides an opportunity for all stakeholders working on mental health issues to talk about their work and to make mental health care a reality for people worldwide. During the World Health Assembly in May 2021, governments from around the world recognized the need to scale up quality mental health services at all levels. Why this? Because 1 out of every 4 people will have one diagnosable mental illness or the other, and it's 75 to 95% of these will have no access to quality mental health services. And that is why the World Health Organization campaign slogan for this World Mental Health Day is mental health care for all. Let's make it a reality. In today's webinar, there are many questions to be addressed by our panelists. What do we understand by mental health? How important is mental health? What are the various inequalities in the world and how do they affect mental health? How do we maintain a very sound mental health? And to address this issue, our great mental health expert on this platform to address the issue today. One of our panelists is a great physician and a psychiatrist of repute. The first of them is Professor Yegureje, NNOM, and that one means Nigeria National Order of Merit. Only very few people have that in Nigeria. He's a professor of psychiatry at the University of Ibadan and a chief consultant psychiatry at University College Hospital, Ibadan, Nigeria. He's also a director of World Health Organization Collaborating Center for Research and Training in Mental Health, Neurosciences, Drug and Alcohol Abuse in the institution. He is also a professor extraordinary at the Department of Psychiatry, Stellenbosch University, South Africa. He is best known for his work on epidemiology, nosology, and global mental health, and as one of the leading voices of mental health services and policy development in Africa. Professor Yegureje, has published more than 500 peer-reviewed scientific papers, monographs, book chapters, and other reports. He has been listed since 2004 in the top 1% cited researchers in the area of psychiatry and psychology. And according to Clarifate Analytics, he is one of the most influential scientific minds. He has been involved in activities focused on threatening mental health service development in low and middle income countries and chairs the National Mental Health Action Committee, a policy think tank of the Nigerian Federal Ministry of Health. So you will agree with me that today is loaded. So I want you people to sit behind and listen to this great professor of our time. And the second professor is the mother of psychology in Nigeria, Professor Helen Oshinawa. Is a professor of clinical health and forensic psychology. She's also a criminologist. She worked in the University of Ibadan until her retirement in the year 2020. She served as the head of the department until 2013. Professor Helen Oshinawa is a member of the following professional bodies: Nigerian Psychological Association, chartered member of British Psychological Society, Nigerian Society for the Study of Pain, the Network Psychological Studies of Women, Society for Psycho-Oncology, Nigerian Association of Clinical Psychologists, and is the current national president of this association. Professor Helen Oshinawa has many publications to her credit, and is a great teacher of many teachers. And she has served as a fellow of Women and Documentation Center. Is also an affiliate member, International Federation for Psychotherapy. In 2006, she became a UK chartered psychologist, and she is the coordinator, Center for Behavioral Health and Counseling, Faculty of Social Sciences. She is also a national trainee for universal program curriculum on drug abuse and prevention. Ladies and gentlemen, I want you to sit down and relax and listen to our mental health expert as we promise you a rewarding session of today's webinar. Thank you very much.
Thank you so much, the medical director, for that arousing welcome and for introducing our guest. You would agree with me that there are no other people to do this or to do justice to this discussion today other than this erudite scholar, veterans, and people who had also paid their dues in the field of mental health. Yes, they had years of experience, and I am sure that they would bring all of that to the fore today. Yes, we were starting this discussion today, and then, like the medical director said, it's going to be a panel discussion where we will be asking questions and they would be responding. But please note that we are also streaming live on Facebook. So if you're having difficulties joining on Zoom, you could also link up with us on the Facebook. Just click Yaba Voice. You will see us live there, and we'll be transmitting directly. So please, you could also join us from that site. So, like we said, we'll be looking at mental health in an unequal world, realities, and the way forward. I don't know by vote or by anything. I don't know how many people have mental health facility in their area. I know for a fact that in my own state. Okay, now let me not go to my state now. In my own local government, there are no general hospitals. Yes, they now move down to my town. There is no hospital except for the primary health center, and they only come once in a while to check up on people. So we have days that the doctor and the nurses visit, and you can imagine when someone now gets sick in the course of they not being around, what now happens? Can I imagine if someone now have mental health issues? How will it be addressed? What would they do? These are more things that we will be looking at today as we go on in this discussion. It's an unequal phase in an unequal world, and we are trying to create the balance. And to start off this discussion today is our Professor Yegureje, a man I respect so much, who will be talking to us on what mental health is and how is it relevant to human functioning. I think the understanding of that is what is going to help our discussion today. We need to understand what is mental health and how is it relevant to human functioning. Over to you, sir.
Thank you very much, Kemi. And thank you, Benga, for the earlier introduction. And it's a pleasure to be part of this year's celebration of the World Mental Health Day organized by Yaba. And I really like to extend appreciation for you for organizing this panel discussion today. So the first question that Kemi has asked me is to talk about what mental health is. Let me just first clarify that unfortunately the term mental health has lost its original definition, original meaning, because people now use it as a synonym for mental illness or mental disorder, as a way of trying to avoid the stigma associated with talking about mental disorder or mental illness. But in fact, mental health is not mental disorder, it's not mental illness, it's health. And just the way it is being defined, not just by WHO, but by several other people, it's actually a positive thing to have. Is a state of well-being in which an individual is able to realize their own potential, their own abilities to cope with adversity, to cope with stress, to work harmoniously and productively with others in the community and in their family, and to establish, to be able to establish lasting and rewarding relationship. Along with that is now been added the ability to also have a spiritual satisfaction, by which is not meant that everyone will subscribe to a religion, but it meant to be that you are positively connected in order to be able to have resilience and also be able to face the future with optimism and cope with any kind of challenge that may come your way. So you can actually see that the way that mental health is defined is already linked with functioning, with human functioning. So everything that I've said, they are coping, working productively, being able to contribute to the community, able to start to achieve your purpose in life, to be able to meet your aspirations and all of that. All of those relate to functioning. So it's just like talking about physical health as well. I mean, it's about achieving things, about achieving goals, about able to get things done, and also being able to overcome challenges that may come our way. So that's the definition of mental health, and that's how it is related to human functioning. Human functioning is very central to having a good mental health.
Thank you so much, sir. I love Professor Gureji's opening remark, and that was the fact that he said mental health has lost its original meaning, because yes, when we talk about mental now, the first thing that a whole lot of people in our world believe is that, oh, this person is sick, this person has mental illness. You know, for somebody who walked up to me one day and said, I don't want to come to psychiatric hospital. And I said, why? He said, passing in front of that place itself gives me a scare, because I don't want to see mad people. I said, okay, so those of us that work there, are we mad? Does it mean that we are mad? He said, no, you know, there's this Yoruba proverb that says, when the leaf stays so long on the soap, they automatically, you know, it turns to soap. I say, hey, so you are saying, but you know, that's the mentality of a whole lot of people out there. They really don't even want to know whether it's mental attitude, you know, mental aptitude, or whatever it is mental that you're talking about. But Professor Gureji has been able to highlight the definition of mental health. And you know, if you listen to what he said earlier, it encompasses quite a lot of things. It talks about the well-being, it talks about realizing potential, being able to cope with life's adversity. And you would agree with me that what we're dealing with in this part, at this point in time in our life, is really, really severe for a whole lot of people. I told someone yesterday, I said, I dread just picking up my phone now and receiving a call, because there's so much news is out there. But then we are coping, we're trying to survive. I'm here seated and navigating and just trying to do my own job. I know work harmoniously with other people, and then be able to have a satisfying spiritual life. And you know, you will see it just goes, it cuts across very many aspect. And so that means that the mental health is, no, it cuts across every aspect of our lives and functioning as individuals. Thank you so much, Professor Gureje. We're coming back to you, but right now we're going to Professor Eileen Oshinowo, the Mama of Psychology itself, the national president of NCP. I will be sharing with us what are the mental health problems in Nigeria. And let's look at what are the challenges that we face in terms of when we talk about mental health conditions and other things in this nation, as you know, as a nation generally. Over to you, ma'am. Sorry, she would come up shortly. Over to you, ma'am.
Good morning, the Medical Director, Dr. Oweye, the
All right, so just sorry, we can't hear my technical each there. We were trying to sort that out. She'll be coming back shortly. But like I was saying earlier, the issue of mental health is not even something that we talk about in this nation before now. In Nigeria, the moment you say mental health or mental illness or whatever it is that people call it, the next thing is people overly react and say, oh, it's a weary thing or something like that. You know, there's so much thing that we talk about. All right, so while we're waiting for Mama to be able to, okay, she's back now. Okay, let's hear her. All right, so we're sorry for that technical itch. We're looking at what are the mental health problems, mental conditions that we have in Nigeria before we now start looking at how to tackle them. All right, Professor Eileen Oshinowo.
Thank you very much. What are the mental health problems in Nigeria and how to tackle them? I want to start by saying that we're all aware of the issue of depression, which happens to be the number one great problem that many of us are facing, whether we are experiencing physical illnesses or suffering from any other mental disorder. Depression is common, and number 15 in the global survey. In the number of suicides per year, when individuals are suffering from many illnesses, be it physical or mental disorder, sometimes people are losing control, they are going through despair, they are sad about their situation, and depression is a grave problem. Individuals could be suffering from substance use disorder, and suicide could be one of the problems that such individuals may experience as a result of inability to handle the crisis that goes with unresolved and untreated suicide or substance use disorder. Comorbidity is a big issue when it comes to assessment of individuals who are suffering from various substance use disorder. If not well treated, they may experience problems that could cause severe mental health issues. Stressors in the lives of individuals, which we sometimes refer to as negative life events, if not well handled and if not identified early, could be major source of mental health problem. Post-traumatic stress disorder could bring about poor mental health. Individuals, for example, those who had gone to the Northeast, the army personnel come back and through the combatant activities that went on, shell shock, they find it difficult to cope with return to the society and may experience post-traumatic stress disorder. Even in everyday living, we see individuals who have experienced traumatic stress disorders as a result of childhood neglect or abuse and find it difficult to settle in life. So PTSD is a major issue that, if left unchecked, might create a big problem. Sometimes individuals experience or undergo unemployment or they lose their jobs. What happens if their self-appraisal of their life situation is not managed properly? Life circumstances such as poverty, adversity, these are other areas that could be considered to be problematic when we are talking about mental health issues. Physical health conditions that are severe in cases of cancer, even issues of ophthalmology, which may not be treated properly or not addressed early enough, like cataract. People become depressed. A lot of literature, researches show that some individuals with such problems can become depressed or experience anxiety. Cancer cases, if not well managed, especially when they are at the latter stages of their cancer status, may be problematic. COVID-19, as we all have experienced in the last 18 months, has been a problem. Many individuals are now either unemployed or they have lost their jobs and are facing difficulties with life challenges. The appraisal, what is government doing about this? How will employment be improved upon, whether private or on government basis? Pensioners are having problems having to cope with the economic situation in the country generally. Children and youth have been sent to schools and they are unable to tackle their life situation due to the problems of unemployment of their parents. These are some examples. Thank you very much.
Thank you so much, Professor Elino Shinowo. when she was reading it out, and I said looking at it, and I was telling myself, where do we start from? Where do we handle all of those things? COVID-19 just came in last year. The issue of kidnapping and battery, it's also something that we're also tackling, and that's also affecting our work so much. Issue of physical illnesses and quite a whole lot of other things. And these are some of the things that's just bringing on the whole. And she made mention of depression, and you would agree with me. Quite a lot of people seems depressed out there now. People report this low feelings, loss of interest, not being able to just do the things they used to do before. The energy is not there, the drive is low, and quite a whole lot of other things. But we're still going to how can we resolve all of this things. But let's just move on in this discussion today. I will be going back to Professor Oyegureje, but then I want to read a quote from what was sent out by the WHO towards this World Mental Health Day. I said many people with mental illness do not receive the treatments that they are entitled to and or that they deserve, and together with their families and carers, continue to experience stigma and discrimination. The gap between the haves and they have not grows even wider, and there's continuing unmet need in the care of people with mental health problems. And so I'm going to ask Professor Gureje, mental health in an unequal world, how does it affect us as Nigeria? I know this is like the Yoruba man that has written this, but is it the same thing with us here? All right, over to you, sir. Thank you.
Thank you very much, Kenny. Just before I go to that, let me, since we are talking about mental health in general, let me say that even before a person reaches the stage of acquiring the diagnosable disorders, some of which Professor Shino mentioned, there is also a stage of mental illness or mentally not being well, when in fact there is not yet a diagnosis. I mean, you can imagine a young man who, for example, is unable to climb maybe 3 or 4 flights of stairs, and they are not hypertensive and they are not diabetic, but just because they have not been doing sufficient physical exercise, they are not as able to cope with that little challenge as someone of their own age group. So the same is true for mental health. So you can actually have mental health problems that may not reach diagnosable disease. That is, your well-being is not adequate. You are languishing rather than flourishing. In fact, the COVID-19 that is going on in the world now, a lot of people are affected, their mental health is affected, not in terms of reaching diagnosable level, but in terms of just languishing and not being able to flourish. So we should be mindful of that there is a lot of mental health issue that doesn't get to the point of getting to diagnosis of depression, anxiety, phobia, dementia, and in children, of course, emotional problems and conduct disorders as well. Now, talking about unequal world and how that relates to Nigeria, I would just like to sort of break it into 2 major components. The first is in terms of risk. How unequal are the risks to mental illness across the world and of course in our own country? You know that countries are divided into high income, middle income, and low income, which basically specify the amount of resources available to them. And that actually also captures the risk that people may be exposed to in terms of developing mental illness. So there's already an unequal, that's inequity in the way that the world is composed in that regard, so that people in low and middle income countries, because of the level of poverty in those countries, are more likely to suffer from mental health conditions related to poverty than those in high income countries. So there is already an inequality there, both in terms of the social determinants of health, but also in terms of biological features that may cause mental illness. For example, you know that perinatal problems, obstetric complications and all of those kind of problems are more likely to occur in poor countries. And those are major risks for development of mental health problems later on among children that have a traumatic experience when they are born. And again, that is so unequally distributed in the world. So the risks are not equally distributed. So mental health on an unequal world start from the level of risk. Now, when people develop mental illness, how able are they to access care? That is one of the areas. I mean, I think Gbenga mentioned that in his introduction about the fact that about 90% or 80%, depending on the country, of the population who have mental health conditions may not have access to care. And that is so unevenly distributed around the world, so that people in low and middle income countries are much less able to access care. And when they access care, they are also probably more likely to be exposed to human rights violations and abuses, as may happen in many so-called treatment facilities. So the inequality starts from risk, and it goes to access to care and availability of resources to take care of people who may have mental health conditions. And then, of course, within our country, as we are talking now, if you look at the number of psychiatrists in Nigeria, as few as we are, I mean, we have probably just over one psychiatrist to about 1 million people compared to maybe 10 psychiatrists to 100,000 people in Europe. So we are so disadvantaged, but even within our country, you find that 90% of those psychiatrists are located in major cities. You can actually count the cities where all of these 250 psychiatrists or so in Nigeria are located on the fingers of your two hands. So again, there is gross inequality in terms of access to specialist care. And what I've said about psychiatrists is probably even more true of psychologists, who are actually fewer. The clinically trained psychologists are actually probably fewer than psychiatrists. And so, of course, with other specialists in mental health care, so unevenly distributed. Again, that's quite a demonstration of the inequality in terms of care, access to care, even within our own country. So unequal world is a large way of saying it, but actually unequal country too, unequal cities, unequal access. And even within Lagos there will be people who will have ready access to Yaba. There will be many other people who will have no clue about how to get access to Yaba. And that because of their low education, they don't have quite a good awareness. And so there are a lot of things that constitute bottleneck along the way for people to access care, and that may then constitute this unequal world. So it's something that affects us in all those ways because of our status as a low-income country, and also because of the way in which resources are distributed or not available in our country. Another example that I can give you in this unequal world is that now we are training psychiatrists in Nigeria. For every 5 psychiatrists trained in Nigeria, maybe within 2 or 5 years, 2 or 3 of them will find their way out of the country. And where do they go? They go to countries that have times 10 the number of psychiatrists to the population of their population compared to Nigeria. So how unequal, how much more unequal can the world be when the rich Peter is robbing the poor and the poor Paul, so to say? So this inequality is so widespread that it's something that if one puts one's mind to it, it's just so sometimes a little bit frustrating and concerning, certainly. So yes, so mental health in an unequal world is a legitimate area of focus for many of those reasons that I've mentioned. Thank you very much.
Thank you so much, sir. Earlier when Professor Guredi started talking, there's a statement they used. They said languishing rather than flourishing. And I'm holding on to that strongly because that would, it just defines basically the state of many Nigerians. Yes, they are not in the psychiatric hospital, they are not accessing care in terms of mental health, but then a whole lot of people are languishing rather than flourishing. The stress on the road, sir, is making us to languish rather than flourish, because by the time you get to work in the morning, you are tired. To now come and sit down and start seeing patients, it's just hard to know the pressure and everything. But I don't know, maybe we're still flourishing somehow, because we are still here. We're just trying to manage. And then when I went on to talk about the so many things that makes it unequal. And I recall somebody making a statement last week that somebody who is coming to Yaba from Badagry, the cost of transportation is like going to Ibadan or going to Osun State. The amount they have to spend. And you would also imagine that it's also costing a dropout, because sometimes they will tell you we don't have the money to come. And when they don't have the money, they need the care. They want to come, but the finance to be able to do that, it's not available. And that's great. And that agrees with what you have said earlier, the personnel. I don't know, in the last couple of months, quite a lot of people have traveled out of the country. Each day you just hear this person had gone. So by tomorrow, when you don't see somebody, you just assume they too have gone. I don't know how many people is left in Nigeria when you talk about the medical personnel. And that's we will still look at the solution and how to tackle all of those things. But I have to go over to Professor Elena Shinowo right now, and then we'll be looking at the issue of stigma and mental health. Quite a lot of people don't even want to talk about it. Aside from not wanting to talk about it, they don't want even people to know. And when people know, they discriminate a lot. How do we minimize this when we're talking about mental health issues in Nigeria? Over to you, ma'am.
Thank you very much, Mrs. Akintoye. I want at this stage to pay homage to our daddy, Professor Gureje. I remember that the last time we met was 2018 at this psychiatric hospital, Yaba. And we were there to discuss the issue of mental health bill. And he was the chairman. Thank you very much for all the good works you are doing, sir. Again, we met in Abuja. And this whole problem of outdated mental health bill, which came up for public hearing in 2020, February 17, in Abuja, the mental health professionals came out full force to also talk about stigma. And every year, we hold advocacy programs, awareness programs in marketplaces, requesting that we should stop to stigmatize those individuals suffering from mental health problems. As far as headache, malaria is concerned, many of us are quick to say, I have malaria, I have diarrhea. Why are we ashamed when it comes to saying, oh, I feel depressed, I am anxious, or I have low self-confidence, low self-esteem? So it is our duty as mental health professionals to talk about de-institutionalizing. We should stop stigmatizing wherever we are, even in homes. Why do we have to lock up our relations who are suffering from problems associated with mental illness? When family members are together, couples, for example, a man starts to violate the rules pertaining to the dignity of a woman, and the woman becomes depressed. She finds it difficult to talk about what is causing that mental health difficulty. She's not suffering from acute psychosis, but she is unable to function adequately in the home because of the abuse that she's suffering from, or the issue that has compounded discrimination. Hence, we say we rule out discrimination in our various community settings. All of us within the mental health community need to raise our voices against stigma every day. In every possible way, we need to stand up to stigma. If you are not sure on what to do, then you ask those who are trained to assist you with the proper information. How do we fight stigma? We should talk about mental health publicly. On Sunday, during a community outreach to commemorate the Mental Health Day, we were at a market and somebody said, I know of a neighbor who is suffering from mental health problems. And we quickly addressed the issue of stigma when the individual was saying, that is, it is sickness of the brain. I said, whether it is sickness of the brain or it is that of stomach or malaria, sickness is sickness. It is the way that we perceive whatever is wrong with us, the way we cognitively think about it, that's the way we are going to feel about it, and we will behave negatively towards whatever it is. Fight against stigma by talking about it. It is like looking at an issue that we post on our Facebook and we say, please help to fight against this problem. We know of Angela Christie Roach Taylor, who did say that this has been helpful because I got a message or I got an information from the Facebook saying, handle stigma with dignity. We should educate ourselves and others, just like I have said. And I think that the multidisciplinary team, psychiatrists, clinical psychologists, social workers, occupational therapists, we are all working hand in hand to reduce the stigma. Let's take every opportunity to educate people. We should share personal stories and the struggles with mental illness. And as I said, mental health should not just be looked at within the realm of mental illness. I did say that there could be children out there who have been violated by neighbors, by relations, and they are unable to talk about it because of the shame associated with talking about what experiences they have gone through. But these experiences would affect their functioning in schools, with their community members, with friends out there in schools. Once they hear about, oh, this person has been sexually assaulted, they try to avoid, and the person draws closer to himself and unable to share how he feels. It is a learning opportunity for everyone. Let us help to reduce the stigma associated with this. Be courageous. Be conscious of the kind of language that you use when you try to fight stigma. For example, I fight stigma by reminding people that their language matters. So we have to refrain from using mental health conditions as adjectives. This person is suffering from mental illness. Why should it be? We can just say, hello, are you feeling down? How do you feel about discussing what you are going through? Not just say you have mental illness and that's the way that they will just have to take it as if it's something that is difficult to handle. Out there is hope for those individuals who are suffering from this. Encourage equality between physical and mental illness. We feel that people should understand that a disease is a disease. There is no magnitude to it. Show compassion Empathy, when you have relations or you have individuals you are working together, be empathic and treat them kindly. Choose empowerment over shame. Empower these individuals to realize their full potentials with a lot of support. Loneliness should be avoided. You may be in the midst of so many people, but the quality of the support that you provide is very important. Be honest about treatment. Please come out and look after yourself. Let the media know when they are being stigmatizing. Don't harbor self-stigma. I thank you very much for the attention.
Thank you so much, ma'am. I know Mama has quite a lot to say on this, but you know, time is not just our friend usually on this program. But you know, I heard Mama say to us today, your language matters. How do we talk about it? Well, what are the things that we say? How do we relate with those people? Do we just lock them up somewhere and then we get them as not being anything? Your language matters. You must be empathetic even to some of those people. Empowerment over shame. And the media. Somebody was saying last week about this same thing. I said the way mental health is being portrayed, even when people do some of this drama thing and every other thing, it's terrible. And this is also why a lot of people will not even want to come to the hospital. And so thank you so much. I'm going to go over right now quickly to Professor Boyekureje. This issue of stigma, I still wanted to just talk about it in a few minutes, but let's look at, is it better from, yes, those days when, before we were born, when you started out, and now? Is there a difference? Is it still the same thing? What's the change now? What's your experience? Just quickly share that with us in a few minutes, sir.
Well, I don't know. I mean, we don't really have any trend information in Nigeria to show how things have changed in Nigeria. But across the world, certainly stigma is still a problem, but it's been tackled vigorously in many parts of the world. And people have also noticed some improvement in the attitude of the community to mental illness in general. I suspect that may be so in some part of our country, maybe also in some sections of the community, but I think the change will probably be very little indeed. For example, this COVID-19 that has affected the world in the last 18 months or so, has brought about a lot of discussion about mental health and how people are able to are impacted by that, by the COVID-19 and how it affects mental health, and this can affect everyone. And I think that might have changed some attitude, maybe a little bit in terms of people knowing that everyone can be vulnerable, not just because of some perceived supernatural causes, but certainly because of many of the social determinants, including the lockdown, the economic problems, the loss of jobs, some of the things that Professor Shinawa has mentioned. And I think those kind of realization, those kind of awareness and realization will likely make some impact on the level of stigma in the community, but we don't have any empirical evidence to actually say that that is the case. But certainly across the world, especially because of some of the concerted effort that people are making, I think there is certainly some movement towards improvement. I hope it is the same in our country, even if it is so small still, but I hope there will be there is. I mean, one major thing that we have seen over the years, for example, when I started out, like you mentioned, some years ago, we had no civil society organization interested in mental health, for example, none, virtually none. But now you see that quite a variety of groups that are now registered as an NGO and addressing mental health. That itself is it's a sign that people are beginning to be less negative about it, because to constitute an NGO and say you are focused on mental mental health issue in the past will have been seen as a sort of a stigmatizing commitment. But now I think people are able to face that. And so I think there must be some indication of positive movement towards reduction in stigma in our country.
Thank you, Professor Yegureje, for that. I think, yes, like he said, there are no statistics, there are no measures, there are no nothing, but we also know that even in Yaba now, popularly referred to as Yaba left, people still now walk in and still ask for help, and they are referred appropriately. So yes, maybe we may not have the data, but I think it's also getting very better and much more improved over the years. We may not have gotten there, but we are moving there. So I'm going to go over now to Professor Elena Shinawa. We'll be looking at how can we improve the mental well-being of Nigerians? How can we help Nigerians to cope better, deal better when we talk about mental functioning, so that we will give them something to go away with even today, while we're trying to round up this webinar. Yes, ma'am.
Thank you very much. I want to quickly say something about the stereotype, which I think is still very important. I remember whilst I talked about this issue in the past, I said that why is it that people will want to run away from those individuals they think are having problems? They say, "Dakun dakun ya fun were ni komaka." Why don't we say that about individuals suffering from malaria? So that's one message that I'm passing on, meaning move away from this person that is the most severe part, because we see them on the street. But there are individuals within their homes who should not be discriminated against. So we should strive for balance. When we are able to analyze our emotional states, we should be able to reassess ourselves, reappraise whatever we are going through, and try to strive for balance. We shouldn't go too much into the extreme. Let us strive towards a stable emotional state so that we can function effectively wherever we find ourselves, whether in schools, universities, at home, or in the workplace. Take care of your physical health. Exercises. Eat the right type of food. And connect with others. Connect with meaningful others. I'm not just saying that you should go clubbing at the wrong time or be in the wrong place during the time you think you are connecting with others. Assess where you are, who you are with, and how you need to move ahead and stabilize your emotional state. The way you think, the way you feel, and the way you behave. And we shouldn't forget the spiritual aspect, because these days we have religiously and spiritually integrated cognitive behavior therapy. We can use these skills ourselves, look at the areas of the Quran or the Bible, whichever value system we adhere to, and use that to connect appropriately, to think appropriately, and have a balanced way of handling life. Find purpose and meaning in life. Why am I here? What do I believe in? Where am I going to in the future? Where do I want to find myself in the next 1 year, 2 months? And plan appropriately. Connect with significant others and make life a more compassionate one. Nigerians have become less compassionate. Let us look after each other's emotional states. Thank you very much for addressing that area. Thank you.
Thank you so much, ma'am, for that. Professor Elena Shinawa has read out some of those things that we can do to better improve our health. While I go over to Professor Oyegureje, who is going to share his thoughts on the way forward, because this topic is not just complete with looking at the realities, but how can we balance? Can we even attempt to balance? Or what can we do to bridge the gap? I want to acknowledge the presence of Dr. Oluyemi Cecilia Ogun. I can see your picture here. Thank you, Ma. Thank you for being on this call, Ma. All right, so Professor Oyegureje, how can we move forward from all of these imbalances that appears in our world?
Well, yeah, so I think you're still probably talking about how we can improve our mental health and overall. I can just try and maybe summarize what Professor Shinawa has said.
And also access to care, sir. Access to care, can we improve that and other things?
So yeah, that's part of it. That's certainly part of it. The first is if you look at health the way we have defined it, or mental health the way we have defined it, you will see that one important thing that we need to do is to build resilience, because we will always come across challenges and stresses and things that may want to, just like I gave the example of the young man who is unable to climb a flight of stairs, and physical exercise and all of that will be part of what would be recommended for that. But actually, it's also recommended that we should be doing that for our mental health. It's like looking at it as a mental capital. How do we have reserve in our brain, in our emotion, that will allow us to be able to tackle emerging stresses and emerging challenges? It starts from right from the time of being born. When a child is born and they do not experience a traumatic birth, their brain is not damaged. That is one aspect, is one positive aspect for their mental well-being later on in life. When they are growing up, they do not experience abuse, either domestic abuse or any form of bullying. That also is building their mental capital and building their resilience. And then, of course, things about nutrition and physical exercise. And when all of these fail and we still have illness, we should have recourse to early treatment. And that it's not just in terms of treating the mental health condition, but also treating physical health conditions that are predisposing factors to having mental health problems. And having that means that our services ought to be better. At the moment now, we just mentioned about how many specialists we have in the country. We cannot rely on specialists to deliver the level of care that is required in the country. We need to scale up service through primary care services, through primary care part of our public health system. And the only way to do that is to build the capacity of those who provide service in that sector of the public of the health sector, to build their capacity through training, to build their capacity through support and supervision, so that they can tackle some of these more common mental health conditions early. Early treatment is crucial, and it cannot be done when everyone will have to only go to Yaba, or go to Usage, or go to any of the psychiatric hospitals. It can only be done when the services are available to them close to where they live in primary care settings. So we need to advocate for that. We need to advocate for better policy attention. Better policy attention will, of course, encompass not just the implementation of existing policy in the country, but also laying out specific plans for how to achieve some of those goals that are laid out in the policy. Unfortunately, the current policy that we have, which was adopted in 2013, has not been complemented by a plan by the government. And this, if a plan is developed, some of the things that we're talking about expansion of service and scaling up through task shifting and all of that, training primary care providers to use existing tools, including, for example, MH gap. All of these will be things that should be part of our priorities in terms of making service available. In our lifetime, all the people on this call, in our lifetime, we are never going to have enough specialists in Nigeria. We are never going to, because they are not produced, they are not mass produced in a few months, they are produced over years. So as we move gradually towards expanding our specialist pool of resources, we should nevertheless make use of what we have at the moment, which is the primary care providers who can be trained to provide essential services for those who are in need, and for those who then require specialist services to be referred to the available few services that are there. This is something that is known to the government. The MH gap implementation plan was adopted by the government in 2013 by the National Health Council. So, but it's not implemented. So there are all sort of things that are sitting on the shelf at the Ministry of Health that they're not giving expression to. I know many of our hospitals are doing things around their neighborhood, around their catchment area to expand. I know that Yaba is doing that, and quite a few other places are trying to expand to the community to do outreach services. But this can only become meaningful when government actually pays greater attention to what is required to expand service. So that's what is required at the individual level. We need to build our resilience through some of the things that I've mentioned, good nutrition, physical exercise, and build the brain to be able to cope with stresses and challenges right from birth. And when traumatic experiences are available, we have resources, including social network to turn to for support. And that when illnesses strike, we have places to go to immediately seek attention for early treatment. Those are the things that we can do to improve the population mental health. Thank you very much.
Thank you so very much, sir, for that enlightening, detailed information. And also to Professor Ellen Oshinowo, we want to just appreciate this erudite scholars who had been on this call with us. But we're not going to do this. The medical director is going to appreciate these veterans that we have. It's not easy to have two powerful people in our midst today. We want to appreciate you. Over to you, the medical director, Dr. Lubenga Owoye.
Thank you very much, Kemi, for anchoring this program. I want to say a big thank you to our erudite scholars and a professor in great dimensions. I really appreciate our daddy, Professor Yegureji, for taking out your time to be on this program. We really appreciate you, sir. Thank you, and God bless. And to the mother of psychology, Professor Ellen Oshinowo, I want to say a big thank you for you being on this program, taking our time to be with us on today's World Mental Health Day program. We really appreciate you. I also want to thank some notable individuals on the platform. I can see two of my former medical directors on the platform, Dr. Cecilia Oluwayemi Ogun. I really appreciate you, ma, for coming. I can also see Dr. Harry Lawal. I really appreciate you for being on this program with us. And also, I can also see Dr. Rotimi Koka, okay, a professor from the Lagos State University Teaching Hospital. I really appreciate you. Dr. Obindo, all the way from Jos, a professor of psychiatry. I really appreciate you for being with us on this program. And not that a lot of people in diaspora, most especially Mr. Ismail Yakin from UK. I really appreciate you for being on this program. And there are quite a lot of people, Dr. Adelusi, a lot of people on this program, and a lot of our consultants being on this program today. Time may not allow me to mention the name one after the other. And Pamela Udoka, I really appreciate you, a friend of Federal Neuropsychiatric Hospital, on many occasions. I really appreciate all of you. Thank you for coming. By the grace of God, we have another program next month by this time. I will appreciate if you can also join us more to talk about mental health and destigmatize mental health and mental illness. Thank you very much for coming. Over to you, Kemi.
Thank you, the medical director. I'm the medical director and appreciated everyone for being on this call. Thank you so much. We're happy to have you. Please note that this is recorded and will be shared on our YouTube page. You could also get it on our Facebook page. So please, you could just click Yaba Voice, one word. We're there on YouTube as well as the Facebook. Like us, please help share so that people can better benefit from all of this things. And we have our past recordings too on this the YouTube page and the Facebook page. Thank you once again, everyone, for being on this call with us. Next month, we'll hope to look at something very intriguing that would benefit quite a whole lot of people. And by then, we would hope that we have more people on this call with us. So thank you so very much. Please know that there is no health without mental health. So keep taking care of your mental health and be the best that you can. Build resilience. Do everything that you can to improve on your mental health in times like this. Thank you so much, Professor Gureje, Professor Ellen Oshilawa. Thank you so much once again for being here. On behalf of the Yaba Voice team, I want to say thank you to everyone. Please take care of yourself. Have a lovely day. Bye-bye.
Thank you. Thank you.
Wow, that's good.